Today's nursing mindset is this: look beyond the bowel. When patients have constipation, diarrhea, or a change in bowel habits, it's easy to focus only on the bowel movement itself. But experienced nurses know that bowel elimination is often a reflection of what's happening throughout the body. Changes in bowel elimination can be influenced by hydration, nutrition, mobility, medications, stress, illness, and even emotional well-being. Our job isn't simply to ask, when was your last bowel movement? Our job is to ask, why has this patient's bowel pattern changed? That's where nursing judgment begins. The first step is to assess with purpose. A bowel movement is only one piece of the story. Ask yourself, is this normal for my patient? Has anything changed? Could hydration, nutrition, activity, medications, or stress be contributing to the problem? Every assessment finding gives you another piece of the puzzle. Next, analyze what you found. Rather than jumping straight to an intervention, ask yourself, what's the patient's problem? Is it constipation, diarrhea? Could the patient be dehydrated? Is there a bowel obstruction or another condition that requires immediate attention? Clinical judgment develops when you connect the clues instead of looking at each finding separately. Once you've identified the problem, it's time to develop a plan. Think about the outcome you want to achieve. How can you help restore healthy bowel elimination? How can you prevent complications? Remember, every patient is different, so every plan of care should be individualized. Then comes implementation. Many bowel elimination problems improve with simple nursing interventions. Encourage hydration, promote a fiber-rich diet when appropriate, encourage activity and regular toileting habits, provide for privacy, educate patients and families. Every intervention should have a purpose and move the patient closer to the desired outcome. Finally, evaluate. Don't stop after implementing your interventions. Ask yourself, did my interventions improve the patient's condition? Are we moving towards our goal? If not, what needs to be changed? Evaluation helps us determine whether our care was effective and guides our next steps. As you continue developing your clinical judgment, remember today's nursing mindset. Look beyond the bowel. A change in bowel elimination is rarely just about the bowel. It's often your patient's way of telling you that something else needs your attention. When you begin asking why instead of simply documenting what, you're moving beyond completing a task and beginning to think critically about the whole person. That's the nursing mindset. Keep developing yours.